did the gender conversation start within FNSP? I think that's something, Martina, that I kept asking myself when I was, going through the content of this episode.
And I was rather asking myself, how could we misgender and not work on it from the beginning? Because we were rather late in taking it on board. FNSP works on nutrition of women and young children during the first 1,000 days. And there it becomes obvious if you think of kids being raised in families. And men are part of families, so of course they need to be in the picture and they need to be able to play their role for the good nutrition of children and women.
Oh, well, if you want to learn how FNSP actually use these men to help nutrition outcomes, then you are on the right platform today. Welcome back to another episode of Over to You podcast. And in today's conversation, we are looking at how FNSP did their work around gender, specifically how FNSP used men as agents of change in nutrition programming. In today's conversation, I'm joined by Hazel Kantaini. Hazel Kantaini is project manager for FNSP under Care Malawi. I'm also joined by Ivy Valley. Ivy Valley is the monitoring and evaluation coordinator for FNSP, also within Care Malawi. I'm also joined by Anya Schmidt as well as Kate Maungulu-Bota, both from GIZ Malawi under FNSP program. To begin with, I want to understand, could you explain the work that we're doing in relation to gender in the project?
Okay, fine. So our main work was to change negative cultural norms by engaging men and boys. And we did this through gender dialogue sessions, father-to-father groups, as well as working with leaders because they are the custodians of culture.
How was this work structured at community level? And how did you get the communities and, how did you identify the groups that you worked with?
Okay, so in the first place, we worked with the gender office. We engaged the office to train male gender champions. So the office trained 74 male gender champions. And after the training, they were tasked to identify fellow men through sensitizations and community selection of men who they felt were role models. So these gender champions established 37 father-to-father groups.
So how did you identify these, groups that were identified?
So it was the male champion who conducted community sensitizations. So it was the community itself that selected these people. People that the community felt were role models, like they were positive deviants already in terms of gender.
I just want to find out, because we know FNSP is primarily about nutrition, food security and nutrition. How and why did you really think it's important, to bring in men in this component?
Nutrition is a multi-sector, so it requires several actors, and those actors or sectors that are also affecting nutrition. One of them is gender. Gender affects nutrition because we are dealing with issues of men who are decision makers in the family and who also have control over productive resources. It impacts on nutrition because they make decisions, even nutrition decisions in the home. For example, what to eat and what to grow. So it also have an impact in nutrition.
To add on what Hazel has said, the issue of workload sharing and household labor.
Yeah.
If a woman is not helped in terms of the household chores, it means even if we are advocating for women to breastfeed so many times in a day, it will be difficult for this woman to breastfeed the number of times that we want because she's overburdened with the household chores. It was very, very important to talk about gender in nutrition.
And even the decisions for a woman to go and associate with others, they have to seek authorization from their spouses. For them to join the care group, they have to discuss in the home. So if the man says, no, it's no, the woman cannot go.
Yeah,
if the woman goes, it can also lead to gender-based violence. So it was important that we talk about gender in nutrition so that we also improve in terms of nutrition, looking at the gender lens.
How does this, work look like at the community? Perhaps we should listen to this father-to-father member from Salima and hear maybe his perspective on how he looks at this whole work.
My name is Damington from Chifumbi village, under Traditional Authority Pemba. I currently have 4 children. In the past, I had a desire to be a member of father-to-father group, but I had no idea on how to, until the officer from CARE visited me. They introduced me to father-to-father group, where I became a chair and a role model. As a role model in our group, I start from my household, where I share house chores with my wife, such as washing plates and clothes. This morning, I managed to sweep around our premises. Me and my wife have agreed to take part in activities concerning gender in our home. I make sure my young children and family are eating a balanced diet at all times. I also take care of my children, including taking them to the hospital when they are sick. I also share these messages with all community members. I am an example to others who learn from me because I'm not embarrassed. I share gender equality messages in all spaces I find myself in my community. I also urge people to refrain from beliefs that cannot help them to be good partners with their wives.
Remember that you're listening to Over to You podcast with me, Zainab Chisenga. And I'm joined in this episode today by Anya and Kate from GIZ, as well as Hazel and Ivy from Care Malawi. And in today's conversation, we are discussing how gender was integrated within FNSP to realize nutrition outcomes for women and children under 2 years old. I think Anya has something to add as well, to that.
Thanks so much for elaborating on this. I was wondering, Ivy and Hazel, how did women respond to this, that now all of a sudden the focus is on men and on men's groups, whereas the nutrition interventions look at the care group model where only women are involved, and all of a sudden this the focus shifts a little bit to a group that is actually not discriminated or not underprivileged compared to women. How was their reaction to your work and to introducing the concept of father-to-father groups, gender dialogues, etc.?
Culturally, normally issues of nutrition are considered as women issues. So at first it was not easy, even for women to understand, even women to take it, even the men themselves. We did a lot of sensitization, and the gender dialogue helped a lot, because gender dialogue, basically the communities, they identify them for themselves, the negative social norms that they do that impact on their lives. So in this case, on nutrition. So by and by, they were able to understand through interrogating themselves and finding out that what they are doing is actually more harmful than what they are supposed to do. And it also works. Women realize that it's working towards their advantage eventually, and they started to accept that I think this is the way how we should live for us to move forward.
I actually agree with that, because, when I was in Salima, we met this other woman because we had chats with them separately, because, when they both together, they could actually not tell you the truth. So this woman said,
My name is Janet Zilimani from Nanyuru village, TA Maganga. During my first pregnancy, I had no support from my husband. I would come from the farm, carrying firewood and tired. I would start cleaning, cooking alone, and my husband would be sleeping, saying that's a woman's job, as such he cannot help. But once he joined the father-to-father group, when I got pregnant again, he would carry everything, hose, water for us to drink, and he would even look for firewood himself. And once we got home, we would share responsibilities. I would clean, and he would cook. I even asked him if he can cook, and he said everything has a beginning. When I was 3 months pregnant, he offered to escort me to antenatal, something that he never did in the first pregnancy. And he escorted me to antenatal throughout the pregnancy. He even bought me nutritious food to eat, things that were not there in the first pregnancy. I even asked if this was from father-to-father group. Well, if it's from there, let it not end. When I delivered through cesarean section. I could not do any household chores, but my home was well taken care of. People started asking me what love potion I have given my husband. He even helped with taking the child to under 5 clinic and came back with a report. I would tell people that it is care that is teaching the men gender issues, making them change behavior. He proposed that we start a backyard garden at home to have vegetables. At first I was skeptical, but he assured me that we will manage. Then he started with the garden. We both take care of it. He even cooks porridge for our child and add vegetables to the porridge, which was a strange thing to me. And he said that the child needs a balanced diet too. He buys bananas and mash them to make porridge and feed the child. People are learning from us, and now they have their own backyard gardens, though they didn't join the father-to-father group. When they ask how we live so well, I tell them it's all about understanding each other. Even if we move from here, care has taught us a new way of living. Because when we don't have money, we just go to our backyard garden and get vegetables. But before now, we would stay hungry. We will even keep teaching others, even if care is gone. When we want to teach someone, we go and ask them for vegetables. If they say they don't have, we start teaching them how to have their own backyard garden. If they can't afford pesticides, we help them to use ashes. And if they can't afford fertilizer, we teach them how to use locally available resources to come up with manure.
I think for me, that was more of a good reaction from the women, so to say. I think it's been good from what I could observe in the community.
Yeah, when we did our Gender Analysis Plus last year, our consultant also went into the districts and talked to people. And what was interesting for us, what came out was people subconsciously try to fulfill the gender roles that they are assigned. So men subconsciously will try everything to make money, to provide the household with money. Women have a feeling I am the one who needs to cook, who needs to make sure that the children are well and all of that. So when they said, we need to find food first, or we need to make sure that we are not hungry anymore, then we can talk about gender, is actually a catch-22, because if the gender roles were shifted or understood differently, then maybe there would not be any more hunger, because it would work towards a partnership in the household, so what you just described. So in this example, I see that these gender roles have been broken open a little bit and interpreted differently. So the household is actually happier because it is more of a partnership than a delegation to certain things, and less pressure on one person to fulfill one specific task.
I found something interesting as well in the communities. When we engaged some men, they said because of this father-to-father platform that they have, they actually started a community garden. So they do this work together as a group, and they give each other shifts on when they can go water and harvest and go sell. This money is for them. They do have backyard gardens, but they decided, we need to also have something that can give us some money. As you say, it's like a subconscious thing to say, let me provide for my family.
I can also attest during one of our monitorings, which we do monthly, on monthly basis. Sometimes we come across households where we find men cooking for the kids, and when you ask, they would be like, my wife is away, so I have to take care of the kids. Wow. Something very interesting, because they're not like prepared that we are going to come to the house to visit them.
It's spontaneous,
And we even also came across some men who are not yet open, or they are shy for the community to know that they are assisting their wives with household chores. And they, to an extent, that they built a fence around their homes. Wow. So that people should not know that they are washing for their kids or their wives. But it was something very interesting. Wow. And some of these men are not in the father-to-father groups. They have just learned from
the father-to-father model fathers,
So the father-to-father groups have been so very effective, and to an extent that some of these men who have joined father-to-father groups openly say that I have changed. I used to beat my wife. Yes. You can even interview my wife. She will share with you like how our home used to be like in the past before I joined the father groups. But now we are no longer facing such kind of issues. Oh, wow. And these father groups are also targeting homes which are going through gender-based violence, and they have their approaches different kind of on how to approach a home where they're facing these kind of issues. And it's very interesting to see that there is also a sense of ownership. Now it's no longer about that care came with this, but they have realized it's more like an eye-opening. Now they see what's really supposed to be done.
Yeah, that is really true, because I think I was also asking something similar. I think in terms of continuation beyond the project, I asked someone, how do you intend maybe to implement this when Kea leaves? And he said, you know what, earlier I used to know that if I have to give my children food, that's more like a lecture area. People believe in tea a lot. So they'll just give a child tea and, like a bun and stuff, they're done. But since this started, they said, I can make my children porridge and I put the vegetables and everything. It's healthy. I grow this myself. I don't need to be told this is what you need to do. So it was really something more enlightening to know that beyond this, they also know that they can easily do this by their backyard. They don't need somebody to bring resources. It's something that they can easily budget within their limited means to sort of get it done.
And a lot of homes which are doing well when it comes to nutrition interventions, when we talk of WASH, there are homes where the husbands are in these groups, the father-to-father groups. You find that they have a backyard garden, they have the WASH amenities, and most of the times it's the husband who is giving support to the women. Wow. It's really interesting.
Remember that you're listening to Over to You podcast with me, Zainab Chisenga. And I'm joined in this episode today by Anya and Kate from GIZ, as well as Hazel and Ivy from Care Malawi. And in today's conversation, we are discussing how gender was integrated within FNSP to realize nutrition outcomes for women and children under 2 years old. Keep listening. I wanted to ask Hazel and Ivy, probably maybe if you could share some of the highlights that you've seen throughout the course of implementation and maybe the challenges that you have seen in implementing gender within FNSP.
Most men were not helping their wives in caring for the children. For example, as Ivy has said, that workload, women has a high workload than men. And also in terms of issues of nutrition, the men generally, they think that it's women's issue, not men's issue. Now bringing in these men understand in nutrition, how it affects the household as a whole, impacting on the household, socioeconomic elements of the household, realizing that now they are taking up that role and being able to be helpful to their spouses, taking care of the children, helping the women, electing a backyard garden, constructing wash amenities, and all that. So they are doing together because they know the benefits that will come out of them helping women, and even issues of decision to say, okay, knowing that we need these food groups, and most of the problem comes in when it comes to animal protein. Normally, it's a man who makes a decision that, okay, today we are going to kill a chicken, or the best part goes to a man. Now, them, because they know that it is very important that the best part should go to the child or a pregnant woman, because the child is growing. He or she needs more protein to grow. Even the pregnant woman, lactating mother, they need that protein for the baby that she's nursing and for the baby that she's carrying on her womb.
Oh, wow, interesting there. Interesting there. So in case you're just joining us, this is Over to You podcast. And in today's conversation, we are looking at gender, specifically how FNSP used men as agents of change in nutrition programming. Now, Hazel, you started now touching a bit about my next question, because I wanted to ask about the highlights.
For us, the most proud time was when we observed and also got reports about how men were started helping women with household chores, self-reporting on how men changed, and then started involving women in decision-making at household level.
And just to add on, it's also interesting and encouraging to see men influencing other men to do what they are doing.
I totally agree because I
To
saw a
to
lot
break
there.
that
Yeah,
boundary, yes, to
that's
break
true.
that boundary and say we are going out, we don't care what people will say, but we are going to talk about it to other fellow men to be able also to do the same as we are doing.
Yes, sounds like Mr. Dumiton there. He was very proud about that. I was like, Cindy, yeah, like I'm not even ashamed of doing this. I'm part of this community. They need to learn. So
Wow.
yeah, I think I saw that firsthand as well. It was interesting. So how are you going about transitioning, gender-related interventions? Since, FNSP is going towards the end, how are you going about transitioning the intervention specifically, like father to father, the GBV, gender equality practices into government structures and maybe to other government partners that are going to be here after FNSP?
Okay, if you remember very well in the introduction, we said that it is first the gender office that
Yes.
trained the male champion. So
Yes,
it's
yes.
like we are just continuing from where we started. At first, we used all frontline workers from different sectors to do gender work in the communities.
Oh,
But
interesting.
now we have deliberately been specific to
Mm-hmm.
the community development office.
Okay.
And we have handed over all the gender work to the gender and the community development office.
Oh, wow, that's really good because I mean these are the owners at district level and it's a government. So any partner who comes, they can easily take the interventions to them to say, okay, you can continue. This is where FNSP stopped. That's really a good point, I think, for our listeners as well. Some interventions die because there's no, I would say deliberate or intentionality, I would say, to make sure that these things are actually passed on, properly. But I think the fact that even at training level, you involve the gender office, now you're in the community development office, it's a little bit hard for this thing to just fizzle out just like that. I think that's really commendable. Apart from this one, what other mechanisms are in place to ensure that these interventions continue, to be effective and relevant? Because sometimes when you phase out, people are like, so Care left because Care is super famous in Salima. That's what I noted. But now Care is not here anymore. How is this going to be, monitored? We can just stop here. What mechanisms are you putting in place to make sure that doesn't happen?
Okay, we have been working with local leaders. And now we have, for the past 2 years, we have intensified working with local leaders. And some of them, they are father-to-father members, and they are doing well, actually. Yeah. And today we're discussing with Ivy. She was telling me that she went to the field and she found the group village head lighting a report under a tree. She's a member of father-to-father group.
Oh, wow.
So they are encouraging their people, fellow men, on the forefront, doing what we taught them as father to father, their roles and their responsibilities in terms of issues of nutrition. We are hopeful that with the involvement of local leaders, they'll be able to carry on, because we know that extension workers, they come and go. So they'll be transferred to other areas, and possibly in those areas, they'll talk about when we were in Salima, we were working with Care and we were doing father-to-father groups. And these were the things that were happening and the positives that we saw. They will do that wherever they will go. But right in the communities, we have the local leaders. And we also have the gender facilitators who are there in the field. They are in the community. We'll be working with the local leaders to advance the father-to-father groups and be able to oversee the work of the father-to-father groups.
I remember we had a certain chief close to the lake there in the area of Chief Pemba, yes. And I think he had similar sentiments to what you're saying, and he had some interesting insights.
Zina langa ndi Wedson James Isa, ndi amfuma village headman Sheri Kuruwe.
My name is Wedson James Isa, village headman Jerry Kuruwe from Group Village Headman Kunchongwe, Senior Chief Pemba in Salima District. In 2022, I was chosen by our Senior Chief Pemba to be among the people who were selected to attend a training on gender equality at Gwidize EPA. This was organized by Care, where I was given the role to lead father-to-father groups.
zatiphunzitsa kukhala kuti samasiyana pakati pa amayi ndi bambo pa ndiyambi chimodzi chimene chingayambise madyedwe abwino apa khomo tinati apanga magulu la magrupu akunchonge 25 azibambo amene timakambira timakhala ndi masiku okambira.
We learned the importance of gender equality as this plays a pivotal role in achieving balanced diet. In our village, we organized father-to-father groups of 25 each. In these groups, men are taught the importance of gender equality and the need for the household to have balanced diet. This helps in achieving nutrition security of the household. On gender equality, we stress much on helping our wives doing house chores and any other work that may help them, such as preparing kids to school. I always grow vegetables in my backyard garden as one way of achieving balanced diet at household level. Due to my hard work in backyard garden, I received goats from CARE as a token of appreciation to my job. On the sustainability of the project, we have a program that aims at civic educating households in my village and advise them to implement it in their respective households.
Nde abakeya ikamapita kulibesa kuti tikabwerera pansi tizionera pansi tiyangana kutsogolobe ndithu kuti keya tiphunzitsa izi zisathereko mpazivira kutsogolo.
As you can listen, that's really an exciting, input from the chief, who also happens to be one of the, leaders who is actively making sure that his community is also taking action and being very intentional about, having nutrition, proper nutrition outcomes at the household level. And it was really an interesting conversation that we had there. It also made us to also see that, leaders are basically an arm of government, and probably with the way he's looking at these things, there's definitely going to be continuity in building capacities of his communities even after the project.
I also just wanted to add on another mechanism that is in place to ensure that this continues. Before we have intensified exchange learning visits. Whereby father groups that we feel are a little bit weak, we are facilitating that they go and learn in another community so that they understand that is not only happening in their community, but other communities are also doing it. We feel like with this, it will help to sustain these gender interventions that CARE has been doing.
That's actually a very good takeaway, because now, it creates that community ownership. And I think the ones teaching the others feel proud of knowing something the others don't, and giving them that, insight into how to do things. I think it goes back to what Mr. Damiton was saying, because he said at some point that people actually go to him to ask how he, does everything in his house, because he has a happy household, literally. And also we had another conversation with a certain lady who was also talking about how this is helping her a lot. And even, some women actually think she bewitched her husband and put some concoctions of some sort. So they're coming to learn from us. It just reminded me when you're talking about learning visits. It's doing so much more, even to them individually, beyond just learning how to do these things. It's also a sense of, let me teach my people how to do this so we can also be better, collectively as a community. In case you're just joining us, today we are discussing gender, specifically how FNSP integrated gender within its programming, specifically looking at how men were used as agents of change. I'm joined by Hazel Kantaini, who is the project manager for FNSP under CARE Malawi, as well as Ivy Valley, who is the monitoring and evaluation coordinator for FNSP under CARE Malawi. Also, Anya Schmidt, as well as Kate Mwangulu Bota, both from GIZ in Malawi. Keep listening. So I know, Anya, you work at higher level. Perhaps maybe you could share how FNSP is trying to promote sustainability from the central level.
To start with, to react to what Hazel also said about women claiming their space and saying, wait a moment, now this is what we are supposed to do, like don't intervene, and now this has been taken away from us. I think this has also been kind of a red flag in the gender analysis that we had, where it's great to include men and have the transformation together towards lasting gender norms, towards sustainability, but at the same time not to forget that women structurally underprivileged and more vulnerable than men.
Yes.
So if we are now keep filling the space that we finally created for women to find their space, to fill this up with men again, we will just continue this. So I think this is now coming to your question towards sustainability. It is important to still acknowledge there needs to be a space for men, and we cannot do it without men, but not on the cost of the space for women. I think in terms of nutrition, in terms of agriculture, we see that women, especially on community level, in food production, play an extremely important role. So a lot of women create a lot of agriculture produce, are collectively responsible for nutrition and health in the household. However, when we now look at governance structures, are they represented by women?
Not much.
Or are in the governance structures where we look at leadership, will we rather see men making the decisions, men making policies, men having meetings, there in discussions and technical working groups? So what I see could be done on what should be strengthened is giving women room in those spaces of leadership to represent their fellow women, to bring in what it means to be a woman in the agriculture and nutrition space. And I think that would be, in my opinion, a key for sustainability, for gender nutrition intervention and for that nexus.
How do you do this monitoring for us to also maybe learn from FNSP and see how we can progress within our own project?
On monthly basis, we do receive reports from our implementing partners, CARE and SHA, and from there we are able to collect issues or topics to look into during the time of monitoring. And also from the gender analysis that was conducted, there were some recommendations which were collected, and we had a learning, and at the end of this learning, the implementing partners had to develop their action plans, aligning with the recommendations from the gender analysis. So we gather all this information. From there, we formulate a checklist which acts as a guide to conduct these monitorings. And when it comes to the areas which we are targeting, it's random selection of these households. It's not like we communicate with the IPs that we want such kind of this village.
I like that approach.
Yeah, and even sometimes we're in the field and informing them that we are right here in Salima doing this.
Wow.
Yeah, so the information that we gather, the data that we collect is satisfying, knowing that we are trying to just to check or to confirm what's on papers and what's really happening on ground.
Yeah.
So, that's the strategy that we've been using.
I think that's a perfect one because, that way you can get real-time, updates on how progress is going. And also it also helps even the communities know that we can be visited anytime. What role do you think government partners will play? And I know that maybe Hazel and Ivy did address this at some point, but maybe from your end, what role do you think government partners will play in maybe ensuring continuation of the capacity building efforts, related to gender equality, maybe in nutrition?
So I do think that government partners in so many things, in so many sectors, are having a key role because they are the drivers of the strategy of the country. So I think there needs to be a certain political willingness, but also willingness to incorporate gender into everything that is been doing, and especially referring to policy coherence, because policy is what guides the different sectors. But if these policies are separated from gender, then we will always have the struggle as implementers to bring these two together. But if kind of sensitive to this, if politicians say, like on community level, district level and national level, we are aware of the gender gap, we are aware of disparities in the country, and only when we are coming together we will move this country forward, economically, health-wise, infrastructure-wise, then I think there can be a huge momentum, a huge power and shift towards development and also achieving what Malawi sees for itself to be achieved. So I think government is extremely important.
So apart from the capacity building that has been there, we had a transition workshop where all government partners from different sectors talk of gender, healthy, agriculture. We were just looking at the work that has been done and also identifying the gaps. Yeah, so we developed an action plan from where we decide that the government should take lead on these activities. So the collaboration has already been there, but now just ensuring that we are going in the same direction. So from this transition plan, it's promising that sustainability is indeed there. The district is really willing to take charge of the interventions that have been implemented by the partners.
Perhaps maybe back to the opinions. I would like to just get your thoughts on how and what can various stakeholders do to advocate that gender equality be a priority and practice within government sectors. Because sometimes, people go like, that's gender stuff, ours is say, it's just agriculture, ours is just nutrition. We don't need gender, everybody needs to eat. Why do you think stakeholders could do to make sure that this becomes a policy or something that is like a practice? Because I think clearly from how FNSP has done it, there has been so much positive outcomes that have come out of the inclusion of men in the nutrition programming. Also, because most of the discussions around food in the household are mostly made by women, like the cooking part. What do you think should be done in that regard?
What I think is documentation is very, very important. You document the lessons that you are learning. What are the outcomes that are coming from your implementation? So that becomes part of evidence-based information that will support your arguments to advocate for inclusion of gender equality in policies.
Yeah,
so that's the most important thing.
Okay.
And also, as we are doing the documentation, my opinion, I feel that since we are working with the communities, we are working with the local leaders and the structures, they see. And if we empower the communities to voice out and be able to speak what is working in their area, and that one should go up to the policy level. Because when you're talking about the policy, it has to start from the community. They have to see, even the communities themselves, they have to have their voice on what they feel that is working or that is not working. So that one goes up to the policy level. And the other thing, what I feel is inviting the policymakers to come and see for themselves and see what is working, what is not working, as I've already said.
Yeah, that's true.
And they'll be able, because sometimes, even when it comes to the community, if they don't understand it, it won't work. But if they go and see, they'll understand how the things work and how it is working. They will see the positives, the negatives, and how it can be incorporated in the policy. So the stakeholders, they really need to do these things in order that we advocate for gender equality to be included in the policy.
That's really interesting. I actually like the part of even having policy makers come and see, because sometimes, when you make policies, you're at central level, you are more theoretical, I would say. But when you actually have time to go and actually see the evidence by itself, I think it gives you a deeper perspective on how you should approach your work, or maybe the partners and how they should structure their work. So I think that's a really, really good point. In case somebody's listening to the podcast and they're interested, in adopting a father-to-father model, because it's really one of the unique interventions that I saw. I mean, FNSP was full of unique stuff, honestly speaking. But for me, the father-to-father model was unique on many fronts, because now they were championing the unusual, I would say, in the community. But then I do know that every journey has challenges, because while you've taught me so much good about it, even, we heard from the chief, we heard from the lady whose husband had been one of the champions of being difficult, but he changed because of, the father-to-father model groups, as well as Mr. Damiton at first, who was actually bragging, I would say, for lack of a better word, how this has made him actually a better man and how he works with his wife. What challenges should somebody expect if they want to implement something similar, so that they should keep an open mind?
First of all, if they are to implement a gender intervention, they need to work with the local leaders. And also they need to work with men in the community.
And I mean,
and also,
social norms are always at play, right?
Yes.
Yeah.
In terms of challenges, One of the challenges that we made was some women not accepting and feeling like maybe men are taking up their roles. Culturally, if you are a well-brought woman, that's what you're supposed to do for the household.
Totally.
And another challenge was lack of motivation for other father members to still stay in the groups. Because, men would want something that is bringing income into the household.
True.
For a father member to just go in a meeting and then come back without anything. You know how women react.
Oh, that's a big deal. Yeah, that's true. And also I think because socially men are made to provide. So their failure to provide is a demotivational factor if they don't see the bigger picture of what this is doing to them. Yeah, that's true. I totally agree. Yeah, any parting words for, the listener on FNSP's work specifically on gender interventions that CARE did implement during this period?
I think for me, it's that gender should be integrated in all interventions because it impacts every aspect of life. So it has to be integrated when we are doing any intervention. It shouldn't be an afterthought, but when you're designing the programs, you should integrate the gender issues in there because at one point in time, we work with people. And when you are working with people, issues of gender are always there. So they have to be integrated at the design of the program. As you implement, then you gather lessons, then you modify based on the current situation. That's my important point.
Quite a very powerful take, I should say. The biggest issue is mainstreaming, integration, and making sure that gender conversations are part of all the interventions we're making. Because at the end of the day, I think gender, just like the other interventions, as you said, is more multisectoral. And the inclusion of every gender within the interventions makes it easier for everybody to be on board and to sort of, own the process, address social norms, and every other challenge that may impinge on the success of the project. Before we close, I would love to hear maybe your last words. We'll start with Anya.
Yeah, I think there has great work been done, especially with our partner CARE on the father-to-father groups, establishing something that has been taken up, that looks very promising, that has already made changes in people's lives. So I think if districts can continue with that, hold their communities accountable, showing them a vision of what could life look like if there was more gender equality, how would we move, how would we prosper. I think that is extremely important. And now with the food systems framework coming in, it is even more important to look in different dimensions and in different sectors that we need to bring together, and gender has to be present in each and every one of them. But we should not forget to keep giving women the space, not taking it away by bringing in men, but making it a journey together, a transformation together, where women have the chance to thrive, to bring themselves into conversations that they didn't have access before. And then I think we are on a good way.
I would say transition is promising, as it has already been there. It's been seen from the beginning of the project, and now that the project is phasing out, and the fact that at the community level, there have been strengthening of interventions through the involvement of local leaders, just to make the interventions cash flow sensitive, and also that for the community to easily accept that there is a need, there is a gap or a challenge for them to change. And also empowering the women and also the male engagement, it has proved to be very effective, meaning to say gender and nutrition can never be separated. And bringing in gender, we have seen a lot of transformation to an extent that women now make their own decisions to prepare eggs without seeking consent from their husbands. And also, just to add on that, our program also did local chicken distribution in the areas that we are targeting, just to ensure that there is access to egg consumption. And we've been following on that when it comes to decision making, when it comes to egg consumption as well as meat consumption, which has proved to be very effective with the topic of gender coming within. So, all in all, I can say the transition is promising and the sustainability has been there from the beginning.
Thank you very much, guys. This is the end of our conversation today. And today we are discussing gender within FNSP. How did FNSP use men as agents of change in nutrition programming? I was joined on the podcast today by Anya Schmidt and Kate Mangulu Bota from GIZ in Malawi, as well as Hazel Kantaini and Ivy Valley from Kea, Malawi. Thank you very much, guys, for joining. It was an honor to have you today. And I've been your usual host, Zainab Chisenga. Until the next episode, keep listening, and this one is over to you. Thank you very much.